similar. He also is taking a medication called clonidine for something. And worse yet, he still is a terror in the neighborhood and causes big problems at school and home. Our son seems fairly happy but can't pay attention and is getting further and further behind in school. Our other two children don't have these problems. The teacher said he should be evaluated to see if he has ADHD or ADD. They all believe he needs to be on medication to help him pay attention better. We don't know what to do. Friends and family give us advice all over the place. What do you think? Should we get him evaluated? Should we take medication? Well, they're really two separate questions. Well, actually, they're two questions, but there's some interesting facts here. The one boy is very, very different from their child. And if it's, I don't know anything about the other child, but if the other child has ADHD, he would clearly have the impulsive, the hyper, and the inattentive. This child here clearly has the inattentive component, but this just gives you an example how one size doesn't fit all, and the symptoms are not all the same for everyone. Now, my answer here was, I think you need to get your son assessed for attention deficit hyperactivity disorder. No question about that. The assessment needs to be comprehensive and address the areas of inattention, hyperactivity, and impulsivity. Additionally, it needs to look at potential learning disabilities and any emotional factors that could be impacting his problems of inattention and poor academic performance. And I might add, you can see here what's happening with this child, okay? Kind of typical. Getting further and further behind academically. Can't pay attention, problems are occurring. Okay, the overall assessment will include intelligence, achievement, perception, motor development, physical development, memory, emotional stability, call it what you will. Full history. The part of the assessment is usually coordinated by a psychologist trained in education. Okay, now, and by filling out the history of your son, you'll see how long his inattention problems existed and how it is interfering with his life. Often there will be parents or other family members who exhibit the same behaviors. As part of this process, a family physician, pediatrician, or psychiatrist can be brought in to determine if medication would be helpful. Now, medication. I promise you, I hear this all the time. Medication, medication. Some love it, some don't like it. Now, in this particular case, the parent says that the school is pushing the medication. Now, I would like you, as I told this parent here, advised, you need to see medication as a useful tool when deemed appropriate by a doctor. However, it should be the last approach used if there are changes that can be made in the diet or in the home and school to help the person perform more effectively. If you ultimately agree to use prescribed medication, closely monitor the effects to determine whether to continue or discontinue its use and stay in frequent contact with the prescribing doctor. So, in this case, I indicated the need for the comprehensive assessment. Yes, there ought to be an assessment. Medication ought to be considered, but it certainly ought not to be the first choice. Now, I want to talk about kind of something I haven't talked about yet. And it has to do with this kind of a, I call it a very annoying, self-esteem robbing, just very negative. It's when people come out and say, oh, there's no such thing as ADD, ADHD, ha, 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 ha. These are people that just want to get high on medication or people that want to have excuses for not working hard. Just sit down and pay attention. I'll tell you, that's what you have to do. Well, we hear that all the time. I hear this on the radio sometimes. Somebody will come out and say that. Kind of like this latest kind of situation talking about an actor coming out and saying there's no such thing as postpartum depression. Well, I'll tell you, there definitely is. I saw it with my own life for a period of time with a child. And I've worked with many people with it. It's the same thing here. If you have this condition, and I'm going to be talking very shortly here about medication, more specifically, but clearly, if a person has ADHD, medication may be needed. May not be needed too, but the point being, it is a clear, definite condition. And don't let anybody come out and try to really be negative to you. Now, second article here. I want to read this to you also. A person said, I just heard you on the radio as a guest talking about ADD, but was not able to call in with a question. I'm very upset with my parents. Our hardworking 9-year-old daughter has been diagnosed with both ADD and a reading disorder. She is a wonderful and sensitive girl who has taken a lot over the past years due to her disabilities. She has a tutor, and we in the school work hard with her, and she is doing fairly well. Isn't that nice to hear, by the way, for your parent? When I'm mad about is that my parents say ADD is a bunch of bunk, and our daughter is lazy and has no reading problem. They have said this to her, and we've ignored them, but now we know they've been telling her this all the time when she is alone with them. Now, isn't that a horrible thing to do, by the way? I guess my father is quite aggressive when he talks to her and tells her to shape up, just shape up. I remember that as a child. Fortunately, in this case, the mother said that to me. It was just not that big of an issue with her, the learning disability or the ADHD, but remembered the father always saying, you can do it, engineer, call it what you will, but did not have a lot of sensitivity in this case. So the daughter, now listen to this is painful. She was afraid to tell us and has been scared to be with them alone. She cried last time we were going to drop her off. We felt horrible when she told us what has been happening. My husband is mad and is ready to confront them. Our daughter is very intimidated by them and wants us to do nothing. For now, my husband says he will do nothing but says something has to change. To make things worse, an unmarried sister lives with my parents and has been saying the same thing. I mean, 3 ducks right in the same place. I'm so mad but hate to start a big family fight. My 2 sisters say they will not change and to ignore them and have my daughter do the same thing. What do you think? Well, the main thing here that bothered me, in fact really bothered me a lot from a sense of fairness, is the fact that they would really do this little girl who was working hard as a tutor, trying to do everything right. Well, my response was, you need to say something. This is a form of bullying. It's absolutely bullying, is it not? Your daughter, through no fault of her own, has ADD and a reading disability. She needs encouragement and support rather than psychological abuse, intimidation, and bullying. That's the only word I can use for it. Even if your parents mean well, their approach is hurtful and destructive to her self-esteem. Your daughter needs to know you're defending her and that she does not have to put up with bullying, regardless of the intent of your parents and sister. And if you've had this happen, isn't it painful? Isn't it annoying? Isn't it something to really make you mad? And we're trying to keep calm, by the way. Okay, it makes your daughter feel insecure by their saying, in effect, she is the cause of her problems. That is mean-spirited, untrue, and unfair. She has already been through enough in her young life. You need to emphatically tell them not only are they wrong, but they are damaging the self-esteem of your wonderful daughter and their granddaughter. Let them know this is not acceptable and you will not allow it anymore. To allow this to occur and ignore it would be bad parenting. In this case, by the way, the parents did follow my advice. While I know persons unfortunately need to adapt to insensitive persons in life when it cannot be controlled, this is a controllable situation and must end. Sadly, too many in our society criticize persons with disabilities because they do not understand them and choose to criticize rather than get educated and be sensitive and caring. Hopefully, your directness can help them, in this case the parents and the sister, I might add, her sister, see the truth and be helpful. If not, they will suffer by not being an active part in the life of both you and your wonderful granddaughter, their wonderful granddaughter or niece. At a level she can understand, you can tell your daughter she does not have to put up with this type of behavior. Explain her disabilities to her if you have not. She needs to know they are real, not her fault, and that she with effort and support can be successful and happy in life. And that is true. So whenever you run into these negative types, you can say something, you can stay away from them. They can certainly be seeking education themselves, but you really don't want to put up with that, with that type of thing. Okay, now, got a couple more things I want to do. I want to go through, this actually is in the Attitude. I might show, this is actually a good magazine for ADHD. Let me just show this to you a minute, right here. It's Attitude, comes out every 2 months, and it has a lot of really good, useful information in it. So I just show this. It's just, well, this is just one. I get this every 2 months. But a lot of good information, useful information. And in there, I've picked up a few things that I'm going to talk to you about. One here is a Dr. Silver, who's a psychiatrist, 7 rules for using ADHD medications. I think they're very good. And I'm going to mention them to you, okay? Make my own interpretations of what the points would be. But make sure the diagnosis is correct, okay? I think this is really important. Because remember what I said before, you could be potentially you could be diagnosed with ADHD and really have more problems with depression, with defiance, with obsessive compulsive, call it whatever you will. So the important thing is make sure that the medication is appropriate, okay? And if there are more than one diagnosis, make sure that the doctor who is doing the medical review and the prescribing the medication is aware that there could be 2 or 3 separate conditions, because that could certainly have an impact. Somebody that is very depressed and also is hyper and impulsive and inattentive, that could lead to a very different type of medication than somebody who is basically always in a good mood but can't pay attention. Okay. Another thing, don't expect to find the right drug right away. Okay, some kids respond well to Ritalin. Okay? Others respond to Adderall. Others could find Strattera works for them. Remember, that's the non-stimulant that I had mentioned to you. The only way to tell is you've got to try. Trial and error. So you don't want to just go on a medication and just stay on it. Don't put your child and say, okay, good, you're on Ritalin now, honey. Good. In 2 years, decide what you want to deal with, even though those are controlled substances that might have to be reviewed. But often the review is not necessarily just changing it. So make sure everything is working. In fact, I did have a child here just recently, in fact, a high school kid. I said, how is that Adderall impacting? Not at all. Can't even tell I'm taking it. I said, really? And that's when I talked to the mother, and I said, hey, I think you ought to really take a look at that. So that is, and by the way, that was a case where there was a slight change in the medication, timing and the whole works, and definitely worked out. Next one is pick the right dose. And remember, I mentioned to you before that with the stimulant medications, the Adderall, the Prozac is an example, not Prozac, excuse me, the Adderall and the Ritalin, the dose is based not on age or body weight, but the rate at which the body absorbs the medications. That's really an important thing, a very good way to put it. So, you know, you could start something with 5 milligrams, 10, 15, 20, it depends on what you're doing, but just gradually use it until you can really get it right. And a lot of times, if the medication is too strong, if the side effects are strong, they will never take it again, not realizing the problem was not the medication, but the particular, dosage. Another thing, don't be too trusting of a medication's listed duration. I think that's another important thing to remember, because a 4-hour pill, quote, might work for only 3 hours. 8-hour might work for 6 or 10 for someone else. It's critical to remember, your body has so much to do with the impact of medication. So don't just look at the box and say, oh, this will be good for 4 hours or 2 hours or 1 hour, whatever it might be. Okay. And make sure your child is on medication whenever it is needed. This is another one of these big debates, okay, that I run into on the Ritalin. Some people take holidays. Some people don't take a Ritalin on weekends. Some don't take it on the summer. I have generally found kids tend to do better if they're on it year-round. If they're taking it a certain time, they continue doing that. But on the other hand, I've had people talk to me and show that's not the case and convince me based on what they see. So every case is different. You as a family, you as a parent, you with your child, depending on the age of the child, and also with the physician who is prescribing the medication, certainly need to look at that. You also need to look at side effects, okay? You know, there can be loss of appetite, sleep problems, headaches, stomach aches, my goodness, all kinds of things. Even some people can get motor tics. So I think it's important to know what the side effects. This is important when you get the medication, to read the information, go to a book, WebMD. I mean, there are different places you can go in terms of gathering information. And don't be too quick to suspend medication use, okay? And this kind of gets into what I was talking about before. Don't just arbitrarily say, well, we won't do it these 2 days or those days, because often it can lead to frustration. The person can actually be doing better when they're used to some type of a change. And that's one of those transitions, going off medication, whatever it might be, that can be difficult. A lot of these kids have trouble with transitions. And that means going from one thing to another. That's why in school or in the home, it's good to be aware, like, Chucky, in 15 minutes, we're going to be going to the grocery store, rather than, Chucky, let's go, and Chucky's involved in thinking of something else. So, but again, back on the medication, do be willing to not just too quickly suspend. It's just a good statement. But that, again, that's something, every kid is different. Every home situation is different. Physicians have different views, and the right thing is to get the one that writes for you. Okay. I have another thing, and this is also something that came out of Adhd here, and this is pretty good. These are not just here; they're myths about ADHD, and I want to end this particular general information session with you about talking about these myths and why it's really important, because a lot of people carry a lot of guilt. And mothers more often than men, than fathers. I don't want to generalize, but it seems that women are the ones who carry all the guilt in the world, or certainly a huge percentage of it. But let me talk about some of the myths here, and I've got a few other things I put in here too. A myth, ADHD isn't a real medical disorder. Well, that's just not true. Okay, that's just not true. It's been recognized as a legitimate diagnosis, okay, medical, psychological, educational organizations, including the National Institutes of Health, the U.S. Department of Education, the American Psychiatric Society, which is in our Bible that we use, the Diagnostic and Statistical Manual of Mental Disorders, okay? It's biological based, imbalance of chemical messengers or neurotransmitters within the brain, okay? So again, yes, it is medical. I just don't think there's any question of that. But again, it's people that don't have a lot of knowledge, don't have a lot of information, not picking on those grandparents there, but I will. And the aunt? There is no such thing. Well, clearly it is a medical condition. And I think a medical disorder, and certainly be aware of that. And don't let anybody be telling you that if your child has been appropriately diagnosed with ADHD, that is not a medical disorder. Okay. Children who are given special accommodations because of their ADHD are getting an unfair advantage. Another pure myth. You're clearly leveling the playing field. If you have a child who, due to attention, you can document, is processing reading materials, as an example, at half the normal rate, okay, of the average rate within a classroom, then giving that child double time or time and a half, double time if we're looking at 2 times, it's reasonable, it's fair. Why would you not do that? That's almost like saying someone can't wear glasses if they need glasses, because it would be unfair to those that do wear glasses or don't wear glasses. Or you can't take Ritalin. Not everybody takes Ritalin. Or you can't take whatever it might be, okay? Yeah, you can't. No, we're not going to allow you, because of your diabetes, that you can take insulin, okay? No. Oh, we won't let you take anything for your bipolar, because that's not fair. So that's just not fair. If you can document a specific problem that is impacting on your ability, your child in this case, ability to function, then you do need accommodations in the school. There's no question about that. And you certainly have that under the Disabilities Education Act. We're talking about federal, we're looking in state laws in terms of that relate to special education services, accommodations, American Disabilities Act. So there's really a lot of things that say that that's just not fair, not true. If you have a problem, accommodation levels the playing field. That's the way it ought to be. It's like golf. What if no one could have a handicap when they golf? I kind of quit playing golf. It's kind of a depressing game. Okay, even though most people I know love it. Okay, children with ADHD eventually outgrow it. No, that's really not true. As I told you, 60, 70, whatever it might be, who have the childhood, they continue in adolescence, 50, 60% continue to have it in adulthood. I'm saying there are even different figures. These figures are 70% who have it in ADHD in childhood continue in adolescence, and up to 50% continue to have it in adulthood. These numbers vary, but the point being, they are clearly huge, okay? Now, and another important thing about adults, often the adults with this have not been diagnosed, okay? And that's really a problem because of the financial problems and other things, troubled personal relationships, but things I'll be getting into in the companion set to this particular one for children and adolescents. Okay. ADHD affects only boys, another myth. Not true at all, okay? It's true that boys tend to be diagnosed much more often, and I think that's because most people interested in diagnosis in the school are going to be the impulsive, hyperactive type that really make it very difficult to teach. And in our society, men have clearly been socialized much more to act out how they feel, be more spontaneous. So it's just a different kind of a situation. And the inattention group, the boys and girls, I'm sure that is an area, and again, I don't really have specific data because I don't know if there's really good data on this, but clearly the girls would be more apt, percentage-wise, to be diagnosed with the inattention. And that may be changing over time as mores and customs change in our society, but certainly for now, boys overwhelmingly anywhere 6 to 9 times in the mental health clinics, 1 to 3 times, or 3 to 3 times, say, call it what you will, large number differences in the private practice. So, but it does not just affect boys, it affects girls too. But as with the inattentive group, I think boys and girls tend to be underdiagnosed. And I think also, for whatever the reason, there is probably a built-in artifact or a built-in situation where people are more ready to diagnose the boy to the girl for whatever the reason. I don't know, but clearly girls certainly have the condition, and I've evaluated many girls, particularly with the inattention. Okay, ADHD as a result of bad parenting. Well, now bad parenting obviously is not going to help. In fact, it'll make things worse with the ADHD. But you can be the best parent in the world, and you may be, but your ADHD child is going to be very difficult to deal with. Very difficult. Very difficult, particularly if they can't control, if your child cannot control impulses, if it's the brain chemistry, it has nothing to do with discipline. So it's really important not to just punish and be strict, because that's going to lead to a collision course that may end the relationship with the child for a lifetime. It certainly could destroy the future of the child, let alone crush your heart and feelings over the years if you feel you've been part of that. So ADHD is, again, it's a medical condition. And what a parent needs to do, in fact, we need to do this with all our children. We need to make an individual program that specifically meets the needs of that particular child. Okay. Children who take ADHD medication are more likely to abuse drugs when they become teenagers. Not true, okay? It's just the opposite. Having untreated ADHD increases the risk that an individual will abuse drugs or alcohol. Appropriate treatment reduces this risk. And this I have read over and over again, okay? And the medication used to treat ADHD, they've been proven safe and effective over more than 50 years of use. They don't cure ADHD, but they're highly effective in easing symptoms. And there are others that believe that, like, if you're not taking the medication, that you're more apt to be doing more risk-taking. I think that's definitely true. Risk-takers are certainly more apt to be getting into substance abuse. Okay, another one, and this kind of gets back to we're going to pick on them again, the grandparents and the aunt. People who have ADHD are stupid or lazy, they'll never amount to anything. Just work harder. Well, just not true. In fact, general trends I think would show persons with ADHD are certainly average to above average. They're clearly not lazy, okay? And again, the list that's given here, Mozart, Benjamin Franklin, Abraham Lincoln, George Bernard Shaw, Salvador Dali. I mentioned Churchill, Einstein before. I mean, my goodness, I mean, this is a who, okay? Who's who, if you will. So anyway, I just think it's important to realize that you and your child, your child can amount to anything that is capable, anything that your child is capable of achieving. Your child can achieve wonderfully. There's no question, about that. And the key thing for you to do is try to set up the environment. Try to do everything you can to help your child succeed. Working with the school, being consistent in the home, looking at medication, having a full team, all those things can really help. But again, not true at all in terms of persons with ADHD will never amount to anything. That's not true at all. So these are really just, they're just myths, if you will, and I just mentioned that to you. Another one, too, is there are some people that believe that ADHD is a disorder that appears with the same symptoms with everyone. Well, that's really not true at all. Everyone is different. Remember I mentioned the one here, the one article I was reading that I had written about the child who was a terror in the neighborhood doing all kinds of things. Well, that child was very different from the child who just had the inattention. And also, I would say that particular child certainly had more than just ADHD, some type of a conduct disorder, certainly, oppositional defiant, type of a thing. So those are just things to remember, try to keep in your mind. So anyway,